I'm Dr. Ben Newman. I'm a coronavirus researcher, and I'm going to try to answer your questions. All right, so the next question is tucked away on a back tab that you can't see, but it's from Sarah Janey. And yeah, how's it going? So the question, which I can't remember verbatim, is something about, is it safe to be vaccinated when you are breastfeeding? And we can just expand that to pregnancy. So we've answered this different times, but the guidance gets updated whenever there's new science, and so I suppose we should update our answers, right? That's kind of what science is. That's what we're supposed to do. So, all right, let us function normally. So the best data that we have so far is coming out of the United States. Other countries are recording this data, and I would bet somewhere in Europe there is a very nice database in a language that I am not as good at searching that would have this information. So for now, I just know that the information is more accessible on the US site than it is on the UK site, as far as I can see, but the guidance is exactly the same. So let's go. Yeah. Up here at the top, we have the page from the CDC in the US, and they're looking at vaccines in pregnancy. And what they've got down here, so they've got people that are reporting as being pregnant, and that's 106,000 as of today, whenever today is for you. And we've got, in addition to that, almost 5,000 pregnant women agreed to be part of a more detailed study, which is this COVID safe, V-safe thing, where they'll give information on just what symptoms are you having, if any, how do you feel today, just like they would do this in the US for anybody that has the vaccine if you're enrolled in the program, and anybody who gets the vaccine can enroll in the program. So it's a pretty good thing, I think. Yeah, and so they go through and essentially, yeah, with 106,000 people in there, it's a pretty good data sample. It's not a dedicated clinical trial. And so that's the thing that hasn't happened yet. They haven't deliberately given this to pregnant women and then observed outcomes, but they've done a sort of retrospective study. And so for the retrospective, we can go to another tab, which is here. Let's get a little picture back. There we go. Okay, so this is in the New England Journal of Medicine. This is the first batch of that they published. It's from, I don't know how long ago, but they only had 30-some thousand people involved. As opposed to 106,000. There we go, 35,691. And you'd be able to figure out the date from this. But, you know, it's the science that matters, not the day in which it was reported, I think. Yeah, of which there are a couple cases in there of loss of the baby, or just, yeah, nothing else like malformations or anything like that associated with vaccination. And they go on to say that further down, it's about the same number of people losing babies who are vaccinated as would lose babies who are not vaccinated. So they can't find any difference, but they say that if you do a longer study and a bigger study, that's how you find if there's something rare going on. And that would be the sort of last stone to flip over, I would say, is looking for some kind of rare thing that would happen in a few people. In the bulk of people, it looks as though it's fine. And yeah, breastfeeding while vaccinated just means you're giving the baby a little bit of antibody. There'll be some neutralizing IgA, as a particular kind of antibody, and that will be passed from the colostrum, which is part of the milk, into the baby. And so what that's going to do, it's not going to go into the baby's bloodstream or anything. It's going to coat the baby's throat, just like milk does. And so if the baby happens to run into a SARS coronavirus 2 virion, then it should end up bound to those antibodies, and it probably won't be able to do anything. It wouldn't necessarily protect the baby against inhaled virus, so it's not everything, but it's a nice thing that you can give your baby. It's at least like partial protection. And there's not any antibodies or things that we pass in breast milk all the time, and it's just normal. It's how babies work, and it's why we breastfeed, yeah, in general. So I can't think of any reason why it would not be okay to be vaccinated when pregnant or breastfeeding based on the information that's out there. If you wanted to see for the UK, the national government refers you to a leaflet of facts. Yeah, and that, well, that's fine for the average person. I don't know. As a scientist, we would like more, and I haven't been able to dig up the big published study. I would assume there is more sort of scientific detail. Here is the big set of guidelines, and their Q&As are basically just the same things that other people would ask. The interesting wrinkle, I think, so who are being offered it? Everybody's being offered the vaccine. If I'm pregnant, what should I do? Then talk to your doctor, of course. Skip down here a little bit. Oh, yeah. So, is it safe and effective? And they're saying, well, we haven't done a phase 3 clinical trial, and so scientifically, hand on heart, we can't say that for sure. But a lot of people in the United States, and so this was just a couple weeks ago, 90,000 pregnant women have been vaccinated and haven't had any noticeable adverse effects. So it looks as though it is safe. And like, well, we will do a study sometime, but yeah, those don't happen overnight. What are the benefits? Yeah, COVID-19 can be worse in pregnant women. So yeah, potentially it's protection for yourself and your baby. So that's pretty good. Does it matter which vaccine I have? The answer is probably not, but the guidance that they give is interesting because they say you want the Pfizer and Moderna. Those are what they would recommend. And that is just because of the very low, like 1 in a million level potential for blood clots in it's more women than not women. So, and they tend to be of childbearing age. So just, yeah, not necessarily anything to do with the pregnancy, but just to do with demographics. You would say, yeah, it's a tiny risk, and I think the risk goes away if it's one of these two, if you have a choice of these two. If not, it's probably no big deal. So there you go. That's as complete an answer as I think is out there and available right now. And yeah, I wish you and your friend all the best. And I don't know, chances are it's been probably a week since you wrote in. She may have already been vaccinated, and if that's the case, I hope everything's going fine. And yeah, all the best to you and them and the baby. All right. Thank you very much. This has been Ask Dr. Ben.